So, as always, I defer to the human randomized control trials. What you tend to find when you substitute saturated fats for polyunsaturated fats, inflammation is basically neutral. There's some studies that show a positive effect of doing polyunsaturated fats, but it probably depends on the individual polyunsaturated fat. And that's the other thing I don't really is difficult, because you're categorizing like everything in this one bucket, and there are some differences between individual fatty acids. Even with saturated fat, like for example, stearic acid doesn't tend to raise LDL cholesterol, whereas saturated fat as a whole tends to raise LDL cholesterol, but there are some saturated fats that don't. So again, it's like we're putting things in buckets, and it's a little more nuanced than that. Then if you look at the effects of polyunsaturated fats on markers of cardiovascular disease, again, tends to either be a neutral or positive effect when you substitute saturated fat for polyunsaturated fat.